This video will be about the Tetralogy of Fallot, and we will focus on the most essential knowledge that you need to know. So first of all, we will have to know what happens. To understand that, let's first look at a completely normal heart. Here we have an illustration of a normal heart with the most important structures. If you want to go over the anatomy, then pause the video here, otherwise let's continue. So back to the disease itself. As you might know, that the tetra part of Tetralogy of Fallot means 4, so there are 4 different things that we need to know. And let's start with the first one. The first problem is with the interventricular septum. What happens is that there is an opening in the septum. A part of the septum is missing, and this gives a communication between the 2 ventricles. The second part is regarding the aorta. If you look at the opening of the aorta, it is nicely located within the left ventricle. In those with the Fallot's tetralogy, on the other hand, it is more located towards the right, so it is situated closer towards the right ventricle. This particular pathology is called an overriding aorta. The problem with this particular pathology is that when the ventricles contract and pump blood, the aorta will now get blood from both the left and the right ventricle. This part is highly variable, and between 5 to 95% of the blood that enters the aorta can come from either ventricle. It all depends on where the opening of the aorta is located. The next pathology is regarding the pulmonary trunk, specifically around the opening of the pulmonary trunk. What happens is that the area around the pulmonary valve gets stenotic. Stenosis means that we have a narrowing of the vessel itself, and this is a problem since the power needed to push blood through the pulmonary trunk must be increased in order to push the blood through. This requires a lot more force than what is normally required. And what happens to a muscle when it has to work harder? It grows. It can grow actually so much that we get to the 4th and last point of the tetralogy, right heart hypertrophy. The result of the tetralogy is what we call a right to left shunt. This means that we have blood that flows from the right side to the left side of the heart. Mostly this is due to the stenosis of the pulmonary trunk. Blood flows towards the lowest point of resistance, and the stenosis will cause the blood to move into the left ventricle and later out of the aorta instead. So how does this disease show itself clinically? First of all, this is a structural heart disease due to a problem that comes from the embryogenesis. Therefore, the patients will be babies and infants. The symptoms can vary in when they present depending on the severity of the tetralogy. Some can be diagnosed shortly after birth, while for some others it may take much longer. So as I hope that you understood, the big problems with the tetralogy is that blood is mixed together. And the end result is that we have hypoxia because we have less oxygenated blood. This will often show itself as cyanosis. Cyanosis is best seen as shown here on the lips, inside the mouth, the ears, fingers and toes. But cyanosis is in most cases not always present. The patients will be hypoxic, but not so much that it will show. But during periods of stress, like when crying or feeding, these patients can experience what is known as TET spells. This comes from an increased pulmonary pressure, giving a temporarily more severe right to left shunting. The TET spells are sudden, hypercyanotic and hypoxic episodes. When the infant experience cyanotic episodes, they tend to squat, and there's a very good reason for that. Squatting causes an increase in systemic vascular resistance. This increase in systemic vascular resistance will lower the amount of blood that is shunted from the right to the left. Blood follows the least amount of resistance, and an increase in this systemic resistance will cause it to want to go somewhere else, which in this case will be to the pulmonary circulation. And the end result, since more blood will now go into the pulmonary circulation, is that we have better oxygenated blood. For diagnosis, there is one tool that is absolutely necessary, that is the echocardiography. This is an example how on and interventricular septal defect can be visualized on an echocardiography. X-rays are actually not used for the diagnosis, but they can indicate a suspicion, and X-rays have a specific science that is actually really quite cool. Take a look at the heart of this X-ray. This is a heart with a Tetralogy of Fallot. Now, if you use your imagination a bit, the heart actually kind of looks like a boot. A boot-shaped heart is one of the most classical features of the Tetralogy of Fallot, and you should definitely know about it. Take a look at the heart again. Yes, it doesn't look perfectly like a boot, but with a little bit of imagination, I hope that you can see it. And to the end, treatment. There is only one main treatment, and the main treatment will of course be surgery. The surgery is usually performed in the first year of life. But the surgery has to be planned, and this takes time, so until this happens we need to try to treat the patients as good as we can. Mainly this involves treating the TET episodes, as in acute cyanotic episodes. What we can do is we can administer oxygen, we can make the patient squat, and if that fails we can try to give beta blockers, which have shown to improve the situation. Thank you for watching. I hope it has been educational. If you have any questions, feel free to post them below. Cheers!